All right, Dr. Kris, welcome back to Dr. Kris and Age Management and Peptides. How are you?
Good, Steve. Little chaotic week, but we're getting through it.
Yeah, a lot of things are going on. I'm Steve Brown, and every week we have a conversation with Dr. Kris about ways that we can take more control of our health. And often it's with things that maybe we're not familiar with. Do want to point out that these conversations are intended as educational and that you should always consult your physician before changing your medical program. And so Dr. Kris is here to be the voice of the audience out there that's really looking to be more proactive with our health. And so, Dr. Kris, we appreciate your time.
Thanks, Steve. I always enjoy it.
So stuff's going on. I mean, there's a lot of people really concerned about resurging, and we're in the flu season. So is it COVID? Is it the flu? Is it a cold? What's going on? And what are some things that maybe we should be considering?
Well, so it is, as we talked off air, it is pretty crazy out there right now. I mean, the COVID cases really are surging right now. It is, in my opinion, it's at its peak. It's never been worse for us as far as cases go of COVID. And when I compare back to like April, May, and when we were kind of all so concerned, that's just a fraction of what we have going on right now. And I do think there's some apathy that's kicked in with the pandemic, and I don't blame people. I call it the pandemic fatigue. We've all kind of been there, done that, and feel like we've got the t-shirt, and we're kind of getting lax in some of our, I'm not saying all of us, but I think some, and I think even myself sometimes find myself not following the rules as closely as maybe I should. And so we're seeing a real surge at our office here with COVID. We're seeing more than we've seen just in the last couple of weeks, probably more than we've seen in the 2 months prior. And, you know, I just want to reiterate that everyone is correct that most patients, the majority of patients, will do very well with COVID, but there are some patients that really struggle with COVID, and they can be what we deem healthy patients. You know, I think that's a very tricky word, healthy patients. Just because you don't take prescriptions doesn't always mean, as we talk about, doesn't always mean that you're perfectly healthy. I don't think there's many of us that are perfectly healthy, at least not at our age. But I just think it's really important that we're doing those things that we've kind of talked about over and over. Exercising. I think it's really important that we keep up that exercise routine. Nutrition, you know, intermittent fasting, as we hit people over the head with it, I think every week, but intermittent fasting is a great way to boost your immune system. And my COVID patients, I'm starting to recommend more and more intermittent fasting with actual COVID patients. So diet, exercise, following a fairly low carbohydrate, good fat diet helps that immune system work better. And then, you know, just simply staying up on our vitamin C, vitamin D, and zinc, keeping those vitamins in our diet right now. We should do it all the time, but especially right now. I think those are like the absolute like basics that we can do, besides the obvious, which is social distancing, not going to places if we just really don't have to. You know, there's so many things in our life. I feel like we just do it because for entertainment purposes. Oh, let me go to Target and just walk around for an hour and just look at stuff. And I think maybe it's not the time for that. You know, certainly support your local businesses, do curbside. Maybe, you know, if you can do it online, I think that's a good way to do it. My wife and I were talking how we're going to probably do our whole Christmas online this year, but still try to do local and as much as we can. But, you know, it just doesn't, it's not worth the risk to me to go into some of these stores right now. And people say, well, are you afraid of getting COVID? No, I'm not afraid of getting COVID. I just know that some patients, there is a possibility if I got COVID that I might not do well with it. Now, I think I will with all of my peptides and vitamins, but there's a chance. But then also lost time at work, the amount of people that I could potentially infect. I mean, that's a huge number. They say that every person could potentially infect hundreds of people by the time it goes down the line of, you know, you exposing a few, they expose a few, and on down the line. So that's kind of my basics: exercise, nutrition, vitamins. And then when you are exposed, then I add some different things to the program at that point.
Yeah, so it's interesting talking about vitamin C, vitamin D, and zinc. And what's been really intriguing to me is that actually vitamin D is one of the things that COVID is a COVID vanquisher. But the problem is the COVID, the size of the virus is small and it easily gets into the cell, whereas vitamin D is bigger. And so it needs some help getting into the cell. And everything in all these conversations goes back to the cellular level. Tell us why that's important. Well, I think it really helped me to understand a healthy cell means a healthy body.
Yeah. So as we've talked about, we're made up of trillions of cells. And, this is just science 101. We're made up of these trillions of cells. And the better, as we age, unfortunately, these cells don't communicate as well as they used to. And they become either malfunctioning or just kind of laying around, not doing their job properly, or sometimes they can become disease ridden and actually cause the problems. And the better that these cells communicate and function, no matter what system of the body we're talking about, whether we're talking about an astrocyte in the brain or an osteoclast in the bone, they're all cells at the end of the day. And the better that the cells function, the better that they communicate, and the better that we overall do, the less disease that we have. I know it's as I say over and over, it's a very simplistic approach, but I think it's where medicine is headed. And I'm very proud to be part of one of these physicians that believes this way. And I'm very proud to say too, this number is growing very, very rapidly in the number of doctors that are kind of starting to take this approach with their patients.
So that started to make sense to me. All right, intermittent fasting, and it's like this big emotional things. I can't fast was the thing that I was thinking, but actually it's not that hard. You stop, you pay attention, and when you stop eating in the evening, let's say it's just 8 o'clock. No more alcohol, no more food, whatever. No
more sleep.
Yeah, you break a little habit. You go to sleep. You sleep better.
Absolutely.
And then you skip breakfast, and you have lunch. You just did an intermittent fast, which is huge as far as your body is concerned.
And so many people sort of fast, as we've talked about before, but they don't truly intermittent fast. I mean, one thing I love about intermittent fasting, it's a little bit of keeping people from some bad habits, because so many patients, especially males, and I happen to have been one of those guys that would walk into the pantry right before bed and grab a couple of cookies or, I don't know, a handful of chocolate almonds or something that I felt like I needed right before I went to bed, which was the absolute worst thing I can do for metabolism, is to put especially something that's carby or high sugar or both into my system right before I go to bed. And so intermittent fasting, I always talk about, there used to be this diet drink that eventually got taken off the market, but it was very popular in Texas, and it's about 15 years ago. And it was, eat a healthy supper, take 30 minutes after your supper, and consume nothing else the rest of the night. And of course, people lost weight because it cut out, if they really ate a healthy meal for supper and then didn't eat between then and bed, well, guess what? You lose weight. I was like, man, that's genius marketing. And so, but intermittent fasting not only keeps people from some of these bad habits, but then it also promotes the growth hormone surge, which happens while we sleep. It helps those B cells and T cells function better in our immune system. We feel better. I have yet to meet anyone that does intermittent fasting and doesn't consistently that doesn't tell me that they don't feel better. Their brain works better. They get less, like I said, immune system, they get less, knock on wood, I may be dinging myself here, but I don't think I've been sick with anything other than maybe some mild allergies in a very long period of time. And there's a lot of things that contribute to that, but intermittent fasting is one really big portion of that.
Yeah, and there's this gain of self-confidence too, to be able to conquer a little thing that you had this obstacle. Oh, I can't do that, but actually you can. And it just has so many good things. And it goes back to the cell. Your cells need time to clean up. And
yes,
when you're digesting, imagine of the fire department, when you're digesting, their body's having to produce insulin. A lot of your food gets changed to sugar. So the fire department needs to go in there and tamp down the sugar in your bloodstream. And at some point it needs to rest. And when it rests, then that's when the janitors come out and they get to clean house a little bit. And when you intermittent fast, it gives your body time to clean up.
And not only that, and that is all true, is that when you don't eat for long periods of time, you don't have that insulin surge like you talked about. But that also allows your growth hormone to work better, because insulin, as I always say to my patients, is like kryptonite to Superman to growth hormone. It doesn't allow it to do its metabolic effects to its maximum capability. Insulin resistant is kind of the bane of anti-aging or age management or functional medicine's existence. Our patients that start to age, get overweight, they start to get insulin resistance, which is before we become diabetic. And I became so frustrated with diabetes and the way we treat it, because when I went into medicine over 20 years ago, the American Diabetes Association said the first way you treat diabetes is diet and exercise. And it's so true. Do you know that they've taken that out? The first way you treat diabetes now is medications. And, I was at a conference this weekend back with Dr. Seeds and the other fellows, like we had talked about. And, we had this discussion of, let's not forget that many times type 2 diabetes is curable. It's curable by doing the things that we're talking about, getting rid of the insulin resistance. What I prefer is to find my patients when they're just insulin resistant and not diabetic and do these things. And again, intermittent fasting is one of my huge treatments. My second favorite to add in has become the ketone esters. As we talk about more and more, there's a great study out now. Ketone esters are, along with Thymosin Alpha 1, the peptide, are my two mainstays for treating COVID these days. It's what I'm using to treat COVID, and I think I'm having really good success with it in my outpatient practice. But there's a great study right now with ketone esters, a true medical study that shows the positive benefits of ketone esters with active COVID cases. It's unfortunate because a lot of this stuff doesn't get a lot of traction in the media, but it's legitimate. It's real. As we've talked about, ketone esters, which the only place you can get it is the link that you showed, the ketone aid, is, it's the most pure fuel that our cells can have to function and to increase that immune system. And so when you combine that with intermittent fasting, when you combine that with a more low carbohydrate, high fat diet, you get some really great responses with the immune system. So I recommend it to my wellness patients, absolutely. And I've yet to have a patient that's used ketone esters for a few weeks that doesn't see the benefits. But with COVID, it's really, really important in my opinion. And now we actually have a true medical study to back up this data.
And again, all ketone esters is just a pure food for the cell.
Correct. Yeah, they're ketone bodies. And so like one of my patients, I had him on ketone esters this week, and thank goodness he's turning the corner right now. He had a pretty severe case of COVID. And he ran out. The one thing I'm learning is I'm using higher and higher doses of ketone esters, and I didn't tell him to order enough because, how much I had him take, and he ran through it really fast. And so his wife, who was doing what she thought was right, she ran down to the pharmacy and came back with some ketone drink and was like, "This is the same, isn't it?" I'm like, "No, that's nothing the same." And so anyway, we're just on a total side note, we're having to now keep it on our shelves here because when people need this stuff, they need it. And unfortunately, ketone esters are only made by Ketone Aid, and you can only get them through Ketone Aid or through Amazon, which is via Ketone Aid. And so that's the only places you can get it. So kind of when you need it, you need it. So anyway, and just a sidebar, if Ketone Aid, if someone does want to buy there, if you just put in the keyword on the code, if you just put Resurge, it upgrades your shipping for free. And so anyway, and then my local patients, if they need some, we do keep it on our shelves.
So they come in these little bottles. They're about this big.
Mm-hmm.
And so I'm not clear exactly like the dosage, but I pour some in the little bit of the cap, top cap. I add it to just a little bit of water, shoot it, and then chase it with some more water.
Yeah, so it's actually the dosing's kind of all over the place on depending what you're trying to do. I typically dose it in it's kind of weight based. So my women, I half dose what my men would dose. A capful is 5 cc's, and so I actually do 10 cc's personally. I do 10 cc's in the morning. I do 5 cc's in the evening. It can be cost prohibitive, so it just depends on the patient and how much they want to spend. When it comes to COVID, I do everything I can for the dollar, but I also want to make sure I keep my patients out of the hospital. And luckily, I can go as high as sometimes 25 cc's 3 times a day with ketone esters when someone's actively having COVID. But anyway, women can get away with 5 cc's once a day to maybe 5 cc's twice a day. Guys, 10 cc's in the morning, possibly. And I like to use a late afternoon dose. It kind of gives me that, even though there's no caffeine in it, it kind of gives me that boost I need to get through the end of my day. A lot of people have had really good success with taking small doses right before bed. I have not personally tried that. That is something that I do want to start doing, is trying it before bed. And I just want to mention one other thing that, not trying to change topics, but you said something off the air that I think is so important that I'm learning more and more about, and that is sleep and the effect that it has. We had kind of, I think we kind of walked a little bit over into the NAD side of things. And NAD is one of those really, really popular topics right now. I've actually literally had a patient email me today, "What's your thoughts on NAD infusions?" And
what does NAD stand for?
So NAD, nicotinamide, adenine, dinucleotide, is basically what our body kind of stores in the morning to use to convert into energy for our cells. And it is tied to a lot of things. It's tied to our nutrition. Imagine that. Another thing tied to our nutrition and our exercise. But it's also heavily tied to our circadian rhythm. And as we get older, a lot of us struggle with sleep, struggle with deep sleep. I'm one of those patients. I struggle with deep sleep, and I'm really working hard at trying to fix that. So we realize that we wake up in the morning, and I always tell patients, I wear my little Oura ring that tells me in the morning how much I slept, how much deep sleep I got. Sometimes I think maybe I'm too addicted to it because it's the first thing I check in the morning. But, we think of, okay, I didn't get a lot of deep sleep. That means I'm going to be tired. We don't realize that not only are you going to be tired, but you're also causing cellular inefficiency by not sleeping well. So it's this humongous, vicious cycle. And, the one thing I still struggle with as a provider is, how many places do I hit this at? And I think the answer is as many places as you can. But if it's okay, I'd like to talk about NAD for a minute. And so, NAD infusions, and I'm not against them. I think they can be useful at times. There's some cases where I think they're good, but I think they're being done improperly across the country most of the time. NAD infusions actually, to be effective and to be safe, need to be over about a 6-hour infusion time. I know there's a place right down the street, not to be named, that does it in 30 minutes. Not only is that not working, it's not safe. There are some potential serious side effects that can occur. And it's just not doing much. You're overwhelming the body. One thing that Dr. Seeds always says that I've really bought into is cell homeostasis. Okay. So you don't need a ton of one thing, because then you want everything in balance. Okay. Everybody's heard of ATP. Well, ATP is energy. We need ADP to convert to ATP. We need fairly equal amounts. We don't like a bunch of one and not much of other. And NAD is the same way. We don't want, so NADH converts to NAD and goes through the salvage pathway, and we use it for the cells, and it can be stolen from some different pathways. I won't really go into that today. That's kind of higher level stuff that's not really necessary for this discussion. But if you put just a boatload of it into the system at once, some people can really have problems. And so I have become much bigger in just supplementing NMN, which is the precursor to NAD. And, there's a lot of good supplements out there with NMN in it. And then that way the body can use that precursor to put it into the pathway to make the NAD as it needs to. And when it needs to ramp up more, then it's got the storage that it needs to ramp up more. But basically your cellular respiration, your metabolism is tied to NAD. And that's why a lot of people have really gotten into these NAD infusions, because they think their metabolism is going to skyrocket if they take this NAD infusion. And again, I am for NAD infusions in certain scenarios. I just think it's one of those things that it goes back to cellular efficiency, and we can actually do this very simply in a very pragmatic approach, and patients will do really, really good.
Well, that's what I like about these conversations. Everyone's looking for a silver bullet, and in our health world, we've been almost brainwashed that there's just a pill that you take every day, a prescription, and that's set it and forget it. But it's not true, because all our bodies are very different. And it seems to me that there's a more comprehensive way, but homeostasis means balanced, basically, right?
Yeah, like within the cell, the major substrates are ADP, ATP. You want homeostasis. You want NAD, NADH. That's what converts to each other. You want NADP, NADPH, but you want them in fairly equal ratios. You don't want tons of more of one than another. And that's what sometimes these silver bullets can do, is you're flooding the system with too much of one thing. Because I'm an osteopathic physician. I could have been an allopathic physician, and nothing against my MD fellows. Okay. I think they're great. But going back to the DO's philosophy is treat the body. Prevention makes the most difference. Don't treat the condition, treat the body. And really, that's exactly what we're talking about. We're just taking it maybe a step further and saying, don't just treat the body, treat the cell. And, just really and truly, given our bodies are an amazing thing. I always tell patients, I always joke, even the dumbest guy has the smartest body. I mean, it's amazing. It's amazing what torture we can put our bodies through and still survive and do well. It just shows that the body has the potential to heal itself. Unfortunately, as we age, that those situations get a little bit tougher, and that's why I don't think there is a silver bullet. I think it's a plan. It's trying to implement as many of these things into our lives that we can. As I tell my patients, I realize not everybody's going to do everything. I don't do everything. I can't sit here and claim that I ate perfectly last week, that I got every single minute of my exercise in. But all we can do is strive each week to do the best we can. Take some of these tips and put them into your life that you feel comfortable doing, that you feel like you can use, of course, under your physician's guidance. But it's just a good starting point. And so many of these things are like intermittent fasting doesn't cost anything. I mean, it's cheaper to not eat in the morning. You save money. You didn't have to go to Starbucks and buy some fancy drink that maybe you would normally get.
That would have sugar. Yep.
Yeah, exactly. They can get the black coffee. That's okay.
But all right, before we start talking about some peptides, let's talk about Alka-Seltzer Gold. What's the big deal here? And it's super interesting to me.
Yeah, so not to be confused by the name, Alka-Seltzer Gold is made by Alka-Seltzer, but it has nothing to do with actual Alka-Seltzer. It's just pure baking soda, sodium bicarb. And the reason that we like the Alka-Seltzer Gold is simply convenience of administration, because if you get a box of baking soda out and try to put it in your bottle of water, it goes everywhere. Whereas these little tablets are so cheap and you can just break them and drop them in your water and you're good to go. So it's just convenience why we like Alka-Seltzer Gold versus baking powder. You can only get it on Amazon, so that's just a little tip. Don't try to go down to your local Walgreens and find it, because you won't. But make sure the box is gold. It says gold on it. but people sometimes will get confused. So it goes back to acidic environments. Actually, like this weekend, it was a fitness or athletic performance conference. And like one thing that really hit home was it's all about acid base. Homeostasis, we want that kind of right in the middle. We want too much acid. And, like typically, like one of the things that really hit home with me, and I think it comes back to Alka-Seltzer Gold, is that like most of our proteins have more acid in them. So like meats, they're typically a little more acidic. And one of the main reasons that we need vegetables in our diet, not only because we need those good nutrients and things, is because vegetables are basic, again, acid base, neutralizing each other. And when you use Alka-Seltzer Gold or sodium bicarb or baking soda, whatever we want to call it, you're basically changing that pH just slightly so that the intracellular pH is more basic, which basically just sets up a battlefield for your immune system that's more advantageous for it than an acidic environment is. And so that's why with my patients, I recommend that they do the Alka-Seltzer Gold, that they also try to stay away, try to keep the sugars low, try to keep the acids low in their diet while we're fighting these infections. But yeah, Alka-Seltzer Gold. So in COVID, I use 2 of them twice a day. And then in just my wellness program, I ask my patients to do 2 once a day in a bottle of water.
What made sense to me is that a flu virus, a cold virus, enjoys an acidic environment. It can flourish. It looks for an environment where it can just go to town. And inside your cells, if that environment is acidic, then it's more inclined to welcome a virus cell in.
The virus basically can live longer and better. It turns the battleground into the favor of the virus versus the battleground in favor of the immune system. And that's all we're trying to do with it. As we've talked about, the Spanish flu was treated basically with baking soda. And, they weren't that far off 100+ years ago with their treatment. Again, it's not meant to be the sole treatment by any means, but it's just another tool in our tool bag to help treat this virus.
All right. Well, so let's talk about peptides. First, let's just do a general we're familiar with peptides because we're familiar with insulin. Right. And so a peptide is basically something that helps our cells communicate better, and it signals certain cells to take certain actions. No?
Correct. Yeah. So the analogy that I've started using with my patients that it kind of makes sense to me is we're at the hardware store, and amino acids, which are the building blocks of our body, are like chain links, and they're great by themselves, but you can only do so much with those. When you put those chain links and make it into an actual chain, you bond them together. Now you can pull a car with it. That's a peptide. They're basically bonded amino acids in a certain sequence to get a certain function. We have over 7,000 of them naturally occurring in our bodies, and scientists and researchers have been able to isolate these peptides, figure out what they do, and either remanufacture them or at least make something that's similar enough to get these functions that we need in our body, because many of these peptides decrease with age, just like our normal hormones do.
And so in the spirit of helping your body or your cells be healthy, because your body is so inclined to heal itself, peptides are they're not a medicine, they're a signaling agent. And it's a great way to inspire your body to take certain actions and begin to repair, because it's diminished over time with our age.
Yeah, correct. Not much I can add on. That's a great statement. And yes, it's just many times it's just signaling the body or causing a function within the body that is most likely deteriorated with age, to amplify that reaction or that action so that we can get the response that we're looking for.
So there's all these formulas and so many out there that it's hard to talk about them all, but there's a handful that maybe a physician like you might recommend for your patients, and those listening, your doctor may agree or want to approach it in a different way. But tell us about Thymosin Alpha 1.
So one of my favorites, and I think I mentioned it very briefly earlier, it's one of my mainstays in COVID treatments. There's actually a study out of China that showed a 33%, excuse me, percent decrease in COVID mortality in severe COVID patients in the ICU with simply adding TA1, which is just a incredible study. And so Thymosin Alpha 1 is made within our thymus gland, which is in our neck. It plays a crucial role in our immune system, especially our innate immune system. And it causes us to basically form more of these T cells and B cells so that they can go out and basically, be our soldiers in our immune system to go out there to go to battle for us, to find things that are foreign, to take them out of our body. It's extremely safe. In my opinion, Thymosin Alpha 1 is the safest peptide that I use, and all peptides, in my opinion, are extremely safe. But this is especially safe. It's the one that when I talk with new providers and they're like, I don't know where to start, I'm like, start with Thymosin Alpha 1, because you don't have to worry about hurting anybody, and patients are going to do well with it. It's absolutely something that I use well before COVID for myself. It's part of my wellness program. It actually helps also with cell senescence, which we've discussed many times, just not today. And so it's just an overall great peptide.
And so again, our default mentality is that, so I take this every day. What's the mode of, what's the word, application?
It can be used many different ways. So if I have a person with COVID, I'll use it multiple times a day. But that's a different scenario. That's where I'm trying to modulate that immune system to its maximum capabilities. And really the only thing that limits my dose in those cases is typically finances, because, when you start dosing a peptide multiple times a day, it can get expensive. But again, saving people's lives and keeping them out of the hospital is the most important thing. But in most scenarios, I use it simply twice a week subcutaneously in my patients. You can bolus dose it half a cc twice a week, and the patients do extremely well. Not only again helping modulate the immune system, but helping with cellular senescence and just overall wellness.
So what are some, when you talk about expensive, or it could be cost prohibitive, take it 2 or 3 times a day, why is that? I mean, can you just get peptides anywhere?
Well, you can. I wouldn't recommend it. And so the one negative of peptides right now, I think the biggest negative is still cost. And we're working on that. The more physicians that prescribe peptides, the cheaper you will start to see these, because simply most of the pharmacies, it's making up batches. And, if you can make up bigger batches, it doesn't cost them a whole lot more than making up small batches. It's really about the time and the effort and the facilities that they have to follow the regulations to make these pure peptides. And I use that word very, very strongly, pure peptides, because, like I had a patient the other day said, I get my peptides off the internet. And that place will remain nameless, but there's one fairly popular one, and their prices are very cheap. But I doubt you have no way of verifying the purity of these peptides. And, I just think that's really risky. Just like when guys tell me they're buying their Viagra from China, it's like, I don't think I would do that. I only use reputable pharmacies and I know what it costs to make these products up. It's not cheap. And, it's like I also do cosmetics, as you know, and I do Botox, and I know what Botox costs. When you see people advertising Botox for cheaper than what it costs, it's like, okay, that makes no sense. There's some form of a catch there, like if a car costs $20,000 to make and I'm selling it for $15,000, that makes no sense. And there's a problem there. And so it's the same way with peptides. That's, I am having some issues with patients trying to buy their peptides just straight off the internet. Facebook, peptides you can find on Facebook. And so you just got to be careful where you're getting them from.
So what are some other peptides that one might be able to take to boost their immunity, to help their healing? What? What do you recommend?
Oh yeah, so God, the list is endless. But one of my other favorites that we will add sometimes in these scenarios is thymosin beta 4. It's the repair peptide. You can get some really good benefits with it. There's another peptide that's actually over the counter, L-Carnosine. L-Carnosine is over the counter. It's an over-the-counter supplement, but it's a dipeptide, and it actually does a really good job with helping with the loss of taste and smell. I'm glad you just kind of triggered me on that. It's what my patients, to try to prevent them from losing their loss of taste and smell, but also those ones that have lost it. I've been using L-Carnosine and getting some really good results with it, and it's like a $10 supplement off Amazon. And so it's really inexpensive, but it is a peptide. And so, and then you can get to, your CJ IPAMORELINs, because those do help as well.
I hate to interrupt, but I want to make sure I have the right. Is it L-Carnitine?
Carnosine, not carnitine. They're very similar, but separate.
So it's a S or a Z?
CARNOSINE.
OSINE. Okay. And
easiest way to find it is just on Amazon.
Mm-hmm.
There you go. And again, that's actually a dipeptide that's over the counter, that does a really good job. It's part of my personal COVID protocol that I use with my patients, because I use the vitamin D, the zinc, the vitamin C, L-Carnosine as well, and ketone esters is my over-the-counter portion of the regimen that I use with my COVID patients.
All right. Now, I interrupted you, but you were starting to talk about another peptide.
Yeah, CJ-IPAMORELIN, which is a growth hormone releasing hormone peptide combined with a growth hormone releasing peptide. And so a GHRH/GHRP peptide. There's some other versions of it. That's my favorite. And CJ-IPAMORELIN is a great growth hormone boosting peptide, which also, again, right back into that pathway of intermittent fasting and exercise and trying to boost growth hormone levels. I try to make sure my patients understand this is not growth hormone. We're not giving the body super physiologic doses of growth hormone. This is simply a peptide to cause the body to release more growth hormone and make more growth hormone. We're not actually giving the body growth hormone. And so it's much cheaper, much safer, in my opinion, than actual growth hormone. And patients can do very well naturally with this product as well to boost the immune system.
So what part of the body makes growth hormone?
Pituitary gland in the brain. Yeah. So, but as we get older, the analogy I always kind of use is it's kind of like a squirrel with its acorns. As it gets a little bit older, it wants to hold on to those acorns a little bit more. Many times it has plenty of acorns. It just doesn't want to let them go. And so that's kind of what we're trying to do, is we're trying to, in a weird way, kind of force the system to release those acorns/growth hormone out into the system so that it can do all the great things that it does.
All right. What's another one?
So let's see. We've talked about thymosin beta, thymosin alpha. There's just so many different ones out there that we can kind of hit. Some docs have even been using another peptide called like GHK-CU, which is an amazing wound healer. We've actually now been using that one. It was one of those that I use it topically on the face for decreasing lines and wrinkles, on the scalp for increasing hair growth, which is another amazing peptide that we can sometimes use for different situations. Really, it's one of those things that it just kind of depends on the patients and what is, the TB4. Going back to TB4, I want to make a point about it really quick. Sorry, I jump around a bit. One of the big things that we're seeing with COVID is that patients get through COVID fairly unscathed. Then they get post-COVID syndrome. And, they're having pulmonary fibrosis from COVID. They're actually having scarring of their lungs. And some of these patients that maybe, and certainly the ones that were on ventilators, but even some that weren't, that maybe just had what they felt to be mild to moderate respiratory issues, are having real, what seems to be long-term pulmonary issues, even though they're COVID negative. Also, the brain. A lot of patients are having issues with brain function. There's some studies out there that say that they think the brain deteriorates approximately 10 years from COVID in some patients. Fatigue. So we're starting to see more and more patients with post-COVID syndrome, which I feel like, and I think I've mentioned this before, I feel like it's something that's not being talked about in America. I feel like once you're considered a survivor, we're like on to the next guy or girl who has COVID.
Mm-hmm.
And I think over kind of like 9/11 was, with all the first responders. And then a few years later, we're like, oh crap, all this stuff that they inhaled is causing them to die. That's kind of, it's out there, but it kind of got swept under the rug. I don't think it got nearly as much of attention as it should have. And I think post-COVID syndrome, we're going to find in a year or two, is going to be a much bigger deal than what it's being portrayed right now. And so that's where I really think the TB4 is a really good thing for that, because pulmonary fibrosis is extremely hard to treat. And I know we have, and I know a lot of other physicians have been having some really good success with the post-COVID syndrome and TB4. Another one that I can't believe I didn't bring it up, BPC 157. So many of these things kind of work together. The immune system, not only are we always talking about cellular efficiency, but we're always talking about just cellular efficiency kind of equals the immune system functioning well. They go together. And so BPC is a crucial peptide. It's made in the gut. It can be used for a multitude of things: the immune system, gut health, brain health, musculoskeletal issues. I especially like the BPC along with the TB4 together. And that's been a lot of what we've been doing post-COVID syndrome wise, has been TA1, TB4, and BPC. Just kind of hitting them as much as we can with good, safe treatment strategies. And patients seem to be doing really well. And if there's anybody out there that does have post-COVID syndrome, and the quicker that you jump on it, the better patients do. It doesn't seem to be one of those things like, I'll just give it a few weeks, you'll be fine. It actually seems to me like the longer we kind of let it brew, the harder it is to treat. And so I think that's going to be important for a lot of the patients listening who maybe have just gotten through COVID, or maybe unfortunately will get COVID down the road, is that really pay attention to the post syndrome. And of course, if you don't have anything, you feel great, good. But if you are having some issues, don't just ignore it. Follow up with your provider, make sure they understand what's going on, and help them guide you through this process.
The nice thing about the BPC 157, it's now available over the counter, and it's you can take it orally.
Yeah, and so it is. We have BPC oral. We actually are able to keep it on our shelves now versus having to order it. And so it's very convenient, easy to take, not horribly expensive. And so, yeah, that's great. That's a great part of it.
So I was reading an article yesterday on, there's obviously a lot of studies now going on as far as therapies or therapeutics for the COVID virus. And I was reading something about melatonin. Well, why would that be something of interest?
I think that simply goes back into circadian rhythm. And actually, that's what you had said off the air that reminded me to bring that up earlier about NAD, and everything is just simply about circadian rhythm and taking those high doses of melatonin. And the thing I'm learning about melatonin is we can use a whole lot higher doses in most patients than what they think they can. Most people take 3 to 6 milligrams. Heck, 20, 30 milligrams sometimes for patients with their physician's guidance can be effective, but also making sure that it's good quality melatonin. I think that's another really important thing. A lot of the supplement quality out there is just not the case. And many times melatonin might be something that your provider might even want to have compounded by a reputable compounder in your area. That way you can kind of guarantee the dosing a little bit better. And because that's one thing I found a problem is just a lot of people go buy a bottle of melatonin down at Walgreens, and and I'll have them up to 4 or 5 doses of it, and it's doing nothing. And we're like, get so frustrated. And then you do some compounded melatonin, and you can immediately get success. And I think it's just that quality, because their supplement market just isn't regulated. And that's another, it's a little bit of a tangent, but that's why it's really important to make sure that the supplements you are buying are good quality. It's from a good source, because there really is no major regulatory agency on supplements. And so it's the wild, wild west when it comes to supplements. That's at least why in our practice, we only sell what we consider pharmaceutical grade supplements that we know are physician only lines that we can guarantee the quality of.
So it's interesting, vitamin D, melatonin, these are things that your body can make naturally, assuming you have some exposure to the sun. But often if we're inside, or we're not exercising or walking or getting some exposure, our bodies become deficient in that. And yet vitamin D is can really be effective against the flu virus.
Yeah, and I like to think vitamin D more of a hormone than even a vitamin. But as I always tell my patients, it'll never be called hormone D. But it does so many things that it's not. I think when you say vitamin D, people think, not that big a deal. But it really is. It's huge for our bones and joints, and everybody seems to know that. But what I always say is, women have been pounded over their heads for the last 25 years to take their calcium, take their calcium, take their calcium. Most women actually get plenty of calcium. They just don't have enough vitamin D. And if your vitamin D isn't there, the calcium is rendered worthless. It has to have the vitamin D to do its job. And so that's where we're limited on, is the vitamin D. Then you get into the immune system, as we've been discussing this whole podcast, and the things it does there. And then mood, it helps mood. That's why, you feel better when you get a little sunshine. That vitamin D level comes up. The problem is that too much sunshine causes us to get skin cancer and causes us to look 80 when we're 50. So we don't want necessarily that. And then most of us work indoors. I know you do. I know I do. I simply can't get an hour of sunshine every day as much as I would love to. I just can't. And so that's why, just simply taking vitamin D, which is so inexpensive, a few cents a day, you can take your vitamin D and do quite well.
So what are some of the supplements? Is it like little capsules? Is it drops? How much should we?
Yeah. So like here is my vitamin D. And so it's just, it's simply a little capsule. And the one that I use with my patients has vitamin A, which is good for your eyes, vitamin D, 10,000 units a day, and then vitamin K2, which is good for the heart. So I think those are really important supplements. So we like to have it all in just one capsule, because we do know that especially men are less likely to take multiple things a day. So the more things we can kind of get together, the better they are. But yeah, it's just one capsule a day, easy to do. There's a lot of different, there was actually, I just saw somebody talking a couple days ago, because I'm listening to a lot of podcasts, but like supplements, so many patients take handfuls of supplements every day. And sometimes what I do with my patients is get them off most of it. I mean, so many of the supplements they take really aren't necessary. I'd much rather have a strategic approach with my supplements than just say, here, take these 43 different supplements. I mean, gosh, some people, it's like lunch whenever they take so many different things. So anyway, that's one thing I really try to do with my patients, is when I do put them on supplements, is truly make sure they understand why we're taking each one, why they're important, that we're not just willy-nilly, my friend read in Reader's Digest that milk thistle, I need it. And so they go buy milk thistle. So there's a place for everything, but that's what we want to use it as in specific scenarios.
All right. So Dr. Kris is helping us really think about our health. There's a lot of things that we can do immediately to help our body Yeah, be more at homeostasis to get more balanced, and that being exercise, a little bit of exercise, some intermittent fasting, paying attention to her diet, and some things like vitamin D. What else, Dr. Kris?
Well, there's just a term that I like to use that is becoming popular with me, and it's called redox. And redox, REDOX, is basically those ratios of, like I said, ADP to ATP, NAD to NADH, NADH to NADPH, in the correct ratios. It's like homeostasis. That's basically your cellular homeostasis, but cellular redox. The closer we can get to optimal cellular redox, the better the cells do, the better we function, the better we feel, the better we think. And at the end of the day, that's what it's about, in my opinion. And it applies to every organ system, as we've already said. And you can, I've talked to new providers into peptides. You can really attack every the neurologic system, the cardiac system. Now, don't get me wrong. We have specific peptides for specific things. But at the end of the day, if you do these general things, it's amazing how most conditions will improve. I'm not here to say that, it's a cure for stage 4 cancer or anything like that, but, it certainly can help. And that's what we're trying to do, is just help the body function as best as it can. That's as simple as I can make it.
All right. So Dr. Kris, he's the voice of those that are wanting to be proactive with their health and take control and do the things that help our cells communicate better. Dr. Kris, what would you recommend? If maybe I have a physician I want to kind of introduce to this, maybe they're not into peptides right now, which not every doctor can be into everything. What's a good suggestion?
Well, again, they're welcome to contact me directly, either through our website or through my email, which is simply Dr. Kris with a K at theresurgeclinic.com. You can also find our phone number on the website. That's a great way to go about it. Depending on the level of interest by a provider, I can then guide them into some different ways to get into peptides. There's a lot of different ways to learn about peptides. I think providers need to be careful, though, where they're getting their information from. There's more and more things popping up, and I think they just need to make sure that it's legitimate providers who've been doing peptide medicine for a while and know what they're doing, and just make sure you're getting it from a good, reputable source, your information.
Yeah, and if your provider maybe is a little resistance to that, or you've been thinking about changing providers, I'm sure you can reach out to Dr. Kris and he'll give you some good directions or suggestions, maybe a provider near you, or maybe Dr. Kris can work with you as well.
Yeah, we actually get leads every day from all across the country. And so we're actually working with another company to actually kind of send those leads back through, so that when they are out of our area, out of Texas, that we can make sure and be linking them up with a provider that would be near them, that we know is a well-trained provider in peptides.
All right. If there's some topics that you'd like to hear Dr. Kris discuss, be sure to send those in and let Dr. Kris know. I'm Steve Brown at ROI Online, and this is Peptides and Age Management with Dr. Kris, and we'll see you next week. Thanks, Dr. Kris.
Thanks, Steve. Appreciate your time.
That's a wrap.